So good morning, everybody. I'm Neil Chase. I'm the CEO here at CalMatters. And Ani Ibarra is with me today, our reporter who's based in Bakersfield and covers healthcare and healthcare-related issues for us at CalMatters. If you don't know us, we are the statewide news organization covering policy and politics and the intersection of state policy and the people it affects all over the state. And I want to spend a little time this morning talking about Medi-Cal. First on, I was going to ask you to just introduce yourself a little bit and talk about your background, how you came to be a kind of a specialist in healthcare reporting.
Yeah, so I've been reporting now for next year will be 10 years reporting, and most of that time I've covered healthcare. And Medi-Cal is such a big part of the beat, so it's a big part of our coverage. And yeah, I'm located in Bakersfield and cover healthcare all across the state, do some policy work, and just also cover anything from access to affordability issues up and down the state.
Excellent. And let's start with a little bit of basic definitions, right? Because people hear terms like Medi-Cal, Medicare, Medicaid. Walk us through the difference, if you would, and clarify, especially what we're talking about when we talk about Medi-Cal.
Sure. So Medi-Cal is the Medicaid program. Every other state uses Medicaid. California, tries to be different. We use Medi-Cal. So Medi-Cal is the program for the health insurance program for low-income people. It's free for most people. Some people do have a very low pay monthly payment. That's different from Medicare. Medicare covers mostly seniors, people 65 and over, and also people with disabilities. There are many people who the state will call the Medi-Medi, which is both people on Medi-Cal and Medicare. So these are usually low-income seniors, for example.
And you have to wonder how long it was from the time they decided to use the name Medi-Cal to the time they realized it looks like medical, and it's very confusing to everybody.
It is very confusing. I just even looking anything up, it's like, did you mean medical? I'm like, no, I mean Medi-Cal.
Got to use the hyphen.
Yeah.
So obviously the name is not the only thing confusing about a gigantic state-run program that serves millions of people. Describe the scope, if you can, of Medicaid. Kind of what does it cover, and how many people roughly are on it in California or should be on it?
Yeah, Medi-Cal is a huge program. It covers about, at its peak, close to 16 million people. I think the last number we saw was 15.8 million. Which is interesting because I remember when I first started covering healthcare, I was reporting the 13 millions. So in this, 10 years that I've been covering healthcare, we've definitely grown by almost 3 million. And that's partly because the state is really trying to open the program for more people, including most recently undocumented people. So more people are coming in. So 15, close to 16 million people, that's about 40% of the state population. So it's a big, important program for a lot of folks out here.
40%, 4 out of every 10 Californians are covered by Medi-Cal, which is it just takes you a minute to kind of pause and understand the scope of that, right? And how many people are affected. So when you look at Medi-Cal before the pandemic, right, what changed at the start of the pandemic? The problem we want to talk about today is people getting kicked off Medi-Cal without knowing it or without being prepared for it. But we have to kind of go back, I think, to the start of the pandemic and understand what was the process beforehand and what changed once the pandemic kicked in.
Yeah. So every year, people on Medi-Cal know that there are what we know as annual eligibility checks. And so every year, just like we sign up for our insurance every fall, people have to submit income information to their county Medi-Cal office and that gets transferred to the state to sort of show that they're still within the income threshold to qualify for the program. And so this is something that people do every year, not at the same time. It's kind of spread out. People can sign up for Medi-Cal any time of the year. So let's say you signed up in June, your renewal month will always be every June, right? And so what changed at the start of the pandemic, March 2020, was the federal government orders states to, because we're having a huge public health crisis, don't drop people off their health coverage. And the federal government said, we'll give states more Medicaid funding as long as you keep people covered. So you can't drop people off. And so that means that for the past 3, going on 4 years, people have not had to do these regular annual checks. And nobody likes to fill out paperwork. That's something super easy to forget. Also, people may have moved during the pandemic. So that means, they might not be getting that information to their new address. So the process is restarting. Starting this year, the federal government said, okay, states, you have to restart this process. And so states are now doing what they call the unwinding period, which is just restarting these eligibility checks all over again.
So basically, for the first time in 3 years, you have to remember or react to a piece of mail that tells you, oh, I need to go re-up my Medicaid every year, even though I haven't had to do it for 3 years. And you have to imagine, especially during the pandemic, people have moved, addresses have changed, lower income people sometimes don't have access to reliable mail delivery, or do or don't have email access, that kind of thing. So it seems like there's a potential for catching a lot of people by surprise, right? So
Totally.
What actually happened? First of all, when did they start doing this? When did the eligibility checks kick back in, and what was sort of the first things that happened?
Yeah, so the state started sending out mail this spring to remind people that, hey, we're going to restart this process. And the first month that applications were due was June. So if you are someone who renews their Medi-Cal application every June, you were the first batch of people to get the what they call the big yellow packet, right, with your 20-page application. And so the June renewals, that deadline was June 30th. So by July 1st, some people started getting notified, that they would be losing coverage because they didn't turn in their paperwork, or, if they didn't turn it in, or if they did turn it in, they don't qualify, that's another reason to get dropped. But yes, so now we are in November. So we've been doing this for several months now. The state is updating data every month, but it is a little behind. So right now we have data from June through end of August. So yes, that's where we are right now.
And do we know how many people got kicked off? You've got the data. So how bad was it for June, July, and August? And how does that compare to what we expected it might have been?
Yeah, so altogether, for those 3 months, we about 500,000 people lost their Medi-Cal. Now, again, this might be people who no longer qualify because they maybe got a new job and they make a little bit more money. But actually, the majority of the people that were dropped because what the state calls procedural reasons. So for paperwork, that means they didn't turn in their paperwork, or that means that there's paperwork missing, right? So the state wasn't able to verify those incomes. So that's probably like the biggest barrier right now that we're seeing.
You mentioned a yellow envelope, right, with 20 pages of forms to fill out. And we don't want to make our own editorial judgment about this, but is that right? Like, is there a sense that you need that much paperwork to figure out if somebody qualifies? Should the process be simpler? Is anybody trying to make it simpler or complaining about the level of complexity, or is that just what's necessary to carry out a program like this?
If you talk to advocates, they'll say, that you don't need 20 pages. They definitely are trying to find ways to make this process more simple, but there is a lot of information that the state requires. And, we say the yellow packet because I think that is what most people are familiar with, but people can also go online. There's a site called Benefits Cal. I don't want to get I think it's benefitscal.com. And you can fill out your paperwork there, upload your needed documents. So that's another way. But as you mentioned, a lot of people prefer to do this either in person by dropping off their yellow packet, or just, having one good thing about having the packet is that if you need help, you can go to, let's say, a Medi-Cal event or to your county office and get help filling that out.
Yeah. So we don't know, have we talked to any of the people who have been dropped? Have you been able to meet anybody who has been dropped and kind of hear their story and whether they were expecting it or what they're doing about it?
Yeah, some people, I have talked to a few people who have mentioned, that they just either didn't get their paperwork because they moved and they didn't know that they were supposed to update their contact information. You can do that by contacting your local Medi-Cal office or online. And other people just, they said that they didn't realize that they had to fill it out. One thing is that some people that enrolled on Medi-Cal for the first time during the pandemic, they've never had to do this. So they don't know the process. They're not familiar with it. So yes, I've talked to a couple of people who were just sort of, like you said, surprised. They didn't realize this was something they had to do. And so I think it's a learning experience for a lot of people, definitely.
And if you get cut from Medicaid, if your benefits get cut and you didn't get the packet in the mail, or they can't contact you, you might not know about that cut in benefits until the next time you try to go get medical care. Is that right?
That's right. I think that's how a lot of people are finding out. It's when you go to the doctor's office and they tell you, oh, your insurance is not, active.
By which time you don't really, if you need medical care, it's not a great time to have to go figure out how to fill out paperwork, right?
Totally.
So what do people do if they're in that situation? If you're lucky, you found out about it before you need medical care, but if you need it right away, what do you do when you find out your Medicaid's been canceled and you weren't expecting it?
Yeah, so for people that I got dropped, one thing is that they do have 90 days to reinstate their Medi-Cal. So if it's been less than 90 days, you can still fill out that paperwork that was sent to you and get that Medi-Cal reinstated. If you are someone who just didn't get the packet or don't know where that packet is now, you can go to your county Medi-Cal office and request one. Again, you can also go online to benefitscal.com and try to make an account and try to fill out the application there. You might just have to, start like as a new applicant.
And do we have any sense how long that takes, either to get your old coverage reinstated or to get new coverage started? Is it hours, days, weeks, months?
I'm not 100% sure, but it's probably, I would say, weeks, right?
Yeah.
It takes some time for those to be processed.
Wow, painful if it happens. I know we fielded a few questions from our readers, and we did an FAQ about the questions. Are there other things in there that we've been asked, or details that we can share that the people ought to know if they're in the situation?
Yeah, a lot of people have very specific questions to their, current situation. A lot of people don't even know if they still qualify. So some people will say, I got a new job, but I think I still fall under just the most, sometimes very generic information of up to what limit will I, or income limit will I qualify? Some people might, one thing is I hear from advocates is just fill out the paperwork, and if you don't qualify, you'll be notified, but don't just think you don't qualify. Definitely if you need coverage, try to get it. One thing is that if you fill out that paperwork and Medi-Cal tells you you no longer qualify for this type of insurance, they will do sort of like an automatic handoff to the marketplace, Covered California, where you can try to get a affordable, insurance. Yes, I would say some of the questions I've heard from readers was, about just how to even start the process. Some people don't know, don't have the packet. They say they never got it, or they say I moved. So it's just redirecting people to where they can find this information on the state website, out there on the county. Actually, I would say the local Medi-Cal offices, so by your county, probably has the most useful information to your particular region or area.
If you can get to that office, and if it's open during the hours that you have access to it, and so on, right?
Right, exactly. That's another thing. You have to, abide by the schedule. And, one thing that we have heard, and that was definitely a concern, and that's one thing that I probably should follow up on, is one thing that was a concern for many counties was just having the workforce and having people available to pick up the phone, and have answer questions for folks who show up in person. That's probably another barrier for some folks, just the long waits to get through.
Yeah, with so many people being affected, and with this weird situation of maybe not finding out you're off the rolls until
Right.
you, which could be a long time. And of course, if you have access to the internet from something like a library or a school, then that's if if you go online, you'll be able to do it more quickly, right?
Correct.
Talk about some of the reaction you got to the story. I know, there's some radio stations I wanted to talk to you about it. There's a lot of people who have questions. What have you heard from people about the coverage you've done and the coverage that you and your colleagues have done here?
Yeah, I think a lot of people are surprised by how many people are getting kicked off Medi-Cal. At the beginning of this whole process, the state did estimate that about anywhere from 2 to 3 million people would get kicked off Medi-Cal. So if we have close to 16 million people and we lose 2 million, that's a big chunk of people. Again, some people we might just lose. When we say lose Medi-Cal, that means they might just be transferring to another type of insurance, like if an employer insurance or covered California. But the vast majority of people may be going without coverage. And California has done so much to try to expand coverage for people that this seems like just a big loss for the state. And of course, for the people that are losing the coverage. So yeah, definitely the numbers. People were concerned about the how many people are being kicked off, but also how many people are being kicked off because of paperwork, because of the procedure, right? Because of the bureaucracy of it all. It seems, I think that is a really interesting part. And it seems concerning to most people because that means people are falling through the cracks, right? They're not getting the message. And I think that's concerning.
Yeah, it's one thing if you're no longer eligible, but so many people. We did some reporting years ago on food stamps, right? And CalFresh, and the idea that I think it was 72% of people in California who qualify for CalFresh actually get the benefits because they go county by county and they're so hard to get. Whereas we went up to Oregon and reported on the same thing, and it was 99% there get it. And so again, it's not fraud, it's not people cheating, it's not people who shouldn't get the benefits asking for it. It's people who should get the benefit and don't have access to the paperwork, don't have access to an office, don't know how to go about it. And I know on the CalFresh stories, that was $2 billion a year of federal money that is allocated and available, just not coming to people in California. This is, we've done stories about benefits fraud and we've done stories about all kinds of things, but this is just plain people who have access to this and should be able to get it and can't. So it's important to create that access.
And I like that you mentioned Oregon, because when there's this great tracker from the folks at KFF, the Kaiser Family Foundation, and they compare all the states, and in California, I think it was 88% of people who are being kicked off because of paperwork, whereas Oregon, it's something like 7%. So it's like there's something going on. Like, why is our process in California so much more difficult? Like it's really interesting to compare.
Yeah, and they'll tell you Oregon's a smaller state, and I don't know, people are nicer there, whatever. But the largest state in the country with the most people should be able to handle this a lot better. And this is not just restricted to this issue, right? There's a lot of technology and process challenges here. Let me ask if anybody else is joining us on the call today has questions. Please feel free to put them in the chat or just unmute yourself and holler if you have a question or anything we can answer, or anything you've heard from people with questions they'd like to have answered. And if so, we'll do that. I guess there's a Q&A here since it's a webinar, if you want to drop your question in there. Otherwise, Anna, as you look forward on this story, how do we cover it from here? How do we keep an eye on it? How do we understand, I don't know, 3, 6, 9, 12 months from now, if things have gotten better, if there's a new process, if people have eventually gotten the help, or if there really are 2 to 3 million people out there who suddenly don't have medical coverage in a state that, like you said, prides itself on having expanded access so much over the years.
Yeah. So definitely, I'll be keeping an eye on that tracker and comparing the months. Like, I think in a way it would make sense that maybe that first month people weren't really aware that this was a process that had restarted. And so, I think that very first month, it was a little bit over 200,000 people that got kicked off. And so I would expect that number to improve over the months as more people become aware of this. But also, just like you said, talking to folks and seeing what is it that that's missing, right? Why did they lose coverage? Is it still the same issue of, not getting the message, not getting the paperwork? Like, yeah, I think it's just talking to people on the ground, talking to, I often talk to advocates because they just have a good pulse of, what folks are going through. Just a few weeks ago, I was talking to someone who's both an advocate, but also helps his parents sign up on Medi-Cal. And he was just saying that, you know, they always request their parents' paperwork to be sent out in Chinese, but, you know, it wasn't sent in the right language. And so he said, if it wasn't for me that I could help them fill it out, you know, they might have not turned it in. So, you know, it's just stuff like that, and getting more examples from folks as to, you know, what some of the barriers are that they face.
And there's also a cost to the state, right? If people don't use the Medicaid benefits that you would expect, and somebody goes to an emergency room, they're not going to get turned away for medical coverage, but then the costs get picked up another way, and you don't have the coverage, and you end up just spending more on the emergency care for somebody who should have been able to go to a doctor's appointment that was covered by Medicaid and would be a lot less expensive, right?
Exactly. Yeah, that's a big part of the argument. Yep.
Yeah. So once again, this isn't actually saving any money. This is just causing problems. But here I go editorializing. So listen, Anna, thanks for this. It's really important information. This is part of a series we call CalMatters for Learning. It's supported and made possible by our friends at the California State Library for use in libraries and schools around the state. And in addition to this webinar, there's a bunch of materials. There are the stories that we did, some worksheets, some learning materials at calmatters.org/forlearning. And that's where you can go grab all the materials to do your own training on this and answer people's questions, calmatters.org/forlearning. And with that, Anna, I will thank you for the time today, and thanks to our friends at the California State Library for making this possible. And we'll see you again soon with another topic. Thanks very much.